Hi, everybody. Welcome to the Survivor Author Series, and we're really happy that you're here with us today. My name's Mary Alto, and today Kineret Sherman is our featured author and cancer survivor, and Phuong Gallagher, many of you may know her, is also a fellow cancer survivor, and she's also a nationally known cancer advocate. This series of events is part of a larger series called the Patient Perspective Series events, and I think a lot of you have attended these events in the past. Couple things, we are going to go probably pretty late in the hour, and then we'll be taking your questions. If you have to leave early, I know some of you have places to be at 1 o'clock and you can't stay for the Q&A. Kineret and Phuong have generously offered that some of you might reach out to her one-on-one and ask questions later, so we can make that available to you. Everyone seems to have my email address. You could go through me or find them online, okay? So that's a possibility. Other than that, we're gonna be having a Q&A, and after that, right at the end of the hour, we're going to be raffling off, and I'm telling you, you've got great odds today. This book, which was written, you published in 2023, right, Kineret? Yeah. So this is a newly published book that Kineret wrote, and we'll be talking about, obviously, today, Healing the Deepest Wounds. So now I would like to introduce better our speakers today, and I'm going to start with Kineret. So Kineret Sherman works as a certified life coach and as a spiritual care provider with private hospices. She holds a BS degree in biochemistry from UCLA, an MS degree in life sciences from the Weizmann Institute of Science, and an MA degree in spiritual psychology from the University of Santa Monica. She also holds certificates in Thai yoga therapy and Reiki. Kineret was diagnosed with rectal cancer in 2015. In dealing with this disease, she has found internal and external resources to help heal her life and in the process, help others. Phuong Gallagher is a 16-year stage 4 rectal cancer survivor and works as the research advocacy training and support program manager for Fight Colorectal Cancer. She was the recipient of the 2023 National Coalition of Cancer Survivorship Ellen L. Stovall Award for Innovation in Patient-Centered Cancer Care and was a panelist at the 2023 White House Moonshot Colorectal Cancer Forum. Phuong continues to live with cancer. Her positive outlook is evident in her advocacy work, and including with the Wonderglow Foundation, Stand Up to Cancer, and the Colon Club. Welcome, Kineret and Phuong.
Oh, thank you, Mary, and thank you to everybody for joining us today. I know your time is precious, especially in the middle of the day, so we really do appreciate it. And Kineret, of course, for joining us to share your story and your book. So why don't we go ahead and get started with your story? You know, we heard from Mary that you're a rectal cancer survivor, but would love to hear a little bit more about your background and you know, your diagnosis. So we could jump right into that.
Yeah, so I was 43 and I noticed there was blood smeared on the stool. And immediately I thought, what is that? That's not normal. And within a week I went to the doctor. And he said, oh, you have hemorrhoids. And he sent me home with a hemorrhoid cream. And I didn't take the cream, but I knew it wasn't hemorrhoids because I'd never had hemorrhoids before. So what was causing them? So I knew, I could feel something was off. I went back a week later and I said, I want more testing. I'm feeling odd sensations here. I don't know what it is. I want more testing. We did testing. Everything came out normal. So I went back a week after and I said, I would like a referral to a gastroenterologist. And I will not leave this office until I have a referral. That's how strongly I felt that something was really wrong. And then between the time of waiting for the colonoscopy, I could feel sensations in my pelvis and I could feel something sucking my own blood onto itself. It was a very clear sensation. I was thinking, what is that? What is that? And then, yes, obviously it was cancer. So there was some relief in knowing what that was. Yeah.
Yeah, you know, I was 29 when I was diagnosed, and I had kind of like the opposite experience from you in that I coming from my background, I did not assert and self-advocate for further testing. You know, when I went in, my doctor basically blew me off and said, "You're too young for it to be cancer," you know, and so I said, okay. And he said it was stress, and here's a couple things you can do. And I went away for a year and a half until a different doctor diagnosed me. So, you know, good for you for pushing to make sure that you got the diagnosis that you needed. You know, we heard about your scientific background. And do you feel like that had anything to do with, you know, your ability to kind of just stand your ground and say, no, this is not right?
I think that my whole life, you know, was advocacy for myself. And so, and I come also from an Israeli background. I was born in Israel. I came here when I was 12 years old. And I think that my cultural background is you assert yourself. And something's not right. What is it? What is it? What is it? So,
yeah. And it's really important to do that because, you know, I say now, you know, you've lived in your body your whole life. So obviously, you know, you feel when something's wrong. And so don't be afraid to keep going until you find those answers.
Totally. For me, there were sensations that were odd. They were not the regular sensations. And plus, seeing this type of a blood on the stool, it's a smear. It's not regular blood that diffuses. It stays on the stool. I was like, this is so weird. It's so odd. And I think a week after I saw the smear, or 2 weeks, there was something from inside that I felt was like a kick. It was like something was like a pew, and I knew you better get going. This is not something funny.
Yeah.
Yeah.
So now you have this background in the scientific side. You have your self-advocacy, but you also share in your book the very spiritual side of your life. Can you tell us a little bit about that and perhaps how you kind of balance the scientific and the spiritual in navigating, you know, what's right for you and your treatments and your journey?
Yeah. So the spiritual background occurred when I was 30, and I can connect to a place inside that's very, very deep. That's really beyond, you know, the mental, emotional life that we experience, beyond the personality. To something that's timeless, that doesn't change, that doesn't get ruined, that doesn't die. However, yeah, then there's a scientific side, very curious. What is this? What's going on? How do I do this? How do I treat this? And so there's almost an excitement about research and looking at things. Yeah, but for me, for the first year and a half, I tried just alternative things. I didn't want to do the conventional medical model. I was too scared of it. So I tried different things. I'd go every 3 months to do a scan, and I'd see, oh, it grew. Oh, it was 1.8, now it's 2.2, now it's 4.5, now it's 5, now it's 10. Now it's getting out of the rectum, it's in lymph nodes. So, yeah.
And I know that you had a lot of family and friends supporting you in that first year and a half in exploring these therapies. Was that a part of the upbringing that you had, or you know, were they just there to support you and just whatever you need, however you need, you tell us, or what was that like?
Yeah, so my family, you know, they're half-half. Some are very medically minded, and some are more natural, holistic minded. And they just said, okay, whatever it is that you do, it's your life, it's your body, it's your choices. We're going to support you. And, you know, when people would come to me and they were scared, and at first there were a lot of people that were scared, I had to calm them down. Please calm down. This is my choice. I know what I'm doing. I'm choosing this. It's going to work great. It's not going to work great. But let me be me. Let me do me.
I think that's one of the really difficult things for our caregivers to do sometimes is to kind of sit back and watch feeling helpless, but they just want to help. And So for those that feel that way, like I just want to help you, but I don't know how, are there any suggestions that you would have for these caregivers to, help you in the most effective way for you, but at the same time to help them feel like I'm doing something helpful?
Yeah. So first thing is to say exactly that to the patient, and to really know that it's their path, even though the caregivers, you are supporters, but it's their choices. It's what's going to happen to them. It's their bodies. So although, still be honest, I'm concerned about this, or I see this and I know this is your choice. I'm going to support you, and let it be. Because when a person gets diagnosed, and I'm sure you know this, suggestions start coming from all over. Facebook, friends, emails. Oh, take moringa. Oh, take, curcumin. Take this and that, right?
Yep.
You've had it too.
And it's all very well intentioned. But as a patient, I know that sometimes some people can get very frustrated by that. And for me, my perspective, I just took it as, I know this person's just trying to help. So it's easy enough for me personally to just say, thank you, I appreciate it. And if it's something that I'm interested in, then I'll explore it more. And if not, then I just take it as an appreciation that it's their way of reaching out.
Yeah, I did the same thing. I just said, thank you, thank you. I did look into some things. Yeah, but it's hard. It's also, there's so much information at the beginning.
There is.
So much.
So, and that's a great point. It's an overwhelming amount of information at a point where you've just been dumped on with this huge news that's just life-changing, and all these questions are running through your head, and it's overwhelming already. So, in finding useful resources, I know that you are looking to help other patients, and I believe that's one of the core reasons why you wrote the book. So let's jump into the book, and let's talk about your desire to help people, and how you structured the book in that intent.
Okay, so this book is a labor of love, for real. It took 6 years. The first 3 years, I wrote a book that was a memoir, and then I turned it into a self-publishing company, and they said, no, sweetheart, you got to turn it into a self-help book. So it took me another 3 years to rewrite a book. That's how committed I am to help people. So this book, it's a lot of different subjects are in there, from a diagnosis and the mental aspects that happen when a person gets a diagnosis. It has all the medical things. It has spirituality. It has nutrition. It has environmental toxicity. It has a lot about female sexuality and the side effects of radiation. It has, and it's written where there's summaries at the end, because it's overwhelming at the beginning. So there's summaries to break it down again. And at the end of every chapter, I generally finish it with a lot of love for the patients. Like, I know this is overwhelming, and I know you're confused, and I trust you, and I know you're resilient, and I know that you've got wisdom, and I know that you're connected to something that's even bigger than yourself, and you're going to find your way. That's super important for me, and it goes throughout the whole book, right? Everybody has their own journey, right? Your journey, my journey, your decisions, my decisions, and yet we find a way to navigate through it.
Yes, yeah. And I think that's really important, is reflecting on what's important for you, and not only reflecting on that for yourself and your caregiver community, but also to be able to share that with your doctors. I know that for me, things really shifted. When I started, I was a wallflower. It was, put your head down, do what the doctor says, don't question it. And that was my upbringing background. And so at one point, I met others like me from the Colon Club, where, it was early age onset survivors. And all of a sudden, this whole world opened up of people who were asking questions of their doctors and who were sharing their thoughts online and all these things. And that really triggered a change in me and how I approached it. And what I found was the more I learned, the more I asked my doctors, the more I communicated, the better my treatments were, because they were more structured to what was important for me. And I could dial back the things that were difficult, like, oxaliplatin would give me the numbness and tingling and the neuropathy. And when I shared that, we were able to dial back the dose, and that resolved a lot of the issues. I was like, oh, such a minor seeming thing really had major impact, And so that's one of the things that I think is really important in that self-reflection, is to actually share it as well with your care team.
Yeah, I so agree. And I love that. I love that. And for that, we need that kind of group support, right? Mm-hmm. For me, I didn't start the group support until later, until after chemoradiation, that I actually got into the colorectal Facebook pages and started asking questions there and receiving a lot of information. And again, that helps to speak with the providers. Yeah. And I think cancer is a journey of empowerment.
Yes, it sure can be. And speaking of empowerment, one of the most important things about your book, and the greatest things, is you really are able to speak without hesitation or fear when it comes to what everybody thinks of as the taboo topics. You can't talk about that in polite conversations. You just cut right through it and you share. How is it that you're able to just be so open and upfront in such a public way? Because a lot of patients need to hear these things, but it's not shared because, again, nobody talks about it.
Yeah. I think, again, I'm going to say part of it is my cultural background, where I come from, and part of it is probably all the programs that I did in spiritual psychology and nonviolent communications, on and on, that it's become very normal to speak about anything. And so this book is quite vulnerable.
It is. And how would you recommend patients to be able to share things like this at times where they may feel less comfortable, but they want to? How did you take that step over that line?
Yeah, it's the Nike slogan, just do it. I remember when I first had started radiation treatment to the pelvis, and within 1 week, I felt the labia buzzing. The labia on the clitoris buzzing. And I thought, why? Why is the labia on the clitoris buzzing? My rectum is not there. Are they kidding me? Am I going to lose all pleasure sensation? And so I went to the technician in that morning. I said, listen, it's been a week and I'm feeling buzzing in the labia and I'm really concerned. It's just like that. It's like the Nike slogan, just do it. And then he took me to the radiation oncologist who said, let me look at the calculations. Oh, you're right. We made an error. Oops. And this happens. It happens. And so that's why, it's so important for me in this book, the advocacy. We are the ones living in our bodies. Even though we have excellent medical providers, good people, they're people. They could be sleepy. Their wife could be going, or their husband could be going through something. Their children could be, up at night and they're not all present 100% of the time. And that's okay. But it's up to you, to me, to us, to be aware. And then, just say it. No shame. This is our bodies. I like my sexuality.
Yeah. And again, taboo topic, people don't talk about that, right? So, I often hear infertility and sexuality kind of lumped together. And I'm starting to see those discussions change in the support forums. But again, we have to talk about it and normalize the conversation. If you think back to years ago with breast cancer, at the time, you're not allowed to say that word. Again, not polite conversation. You don't sit at the dinner table and talk about your bodies like that. But, especially in the current days where, we're talking about biomarkers and precision oncology and family history, we have to talk about that, because if you don't talk about what's happening to you now, how are you going to prevent somebody else in your family potentially from going through the same thing?
Yeah, yeah. I love normal conversations, which is just be honest.
Mm.
I remember when people used to ask me, how are you? And I would just tell them how I was, Yeah. And how empathic people were. Like, I was amazed. I could tell the clerk, I just had chemo, I don't feel good.
Yeah.
Oh, okay. Oh, yeah, I'm so sorry, honey. Or, even dating, like, I went dancing, and then someone asked me on a date, and I was like, what's he going to say when I'm going to tell him I'm doing chemo? And then he would say, okay, will you come dancing tomorrow? And I said, no, I only dance once a week. Why? Oh, because I'm too tired from chemo. Oh. And then he's like, oh, my aunt died of.
Yes, yes.
But it's so good. It's so good. It just cuts through the crap.
File that under things not to say.
Yes. And speaking of, and I want to take it to the radiation. So, and medical transparency. This is something so important for me. I've got so many chapters on this book. Read this book. So listen, I go, right, and they tell me, this is what's going to happen, right? You're going to have chemo and radiation, then surgery, you're going to have a stoma. After you're going to get more chemo, and then we'll reverse the stoma. Chemo and radiation. So this is what's going to happen. It's going to hit your ovaries. You're going to go into immediate menopause. It's going to hit your uterus. You're not going to be able to carry a baby. You're sterile. It might hit your bladder, and you might have bladder issues. And that's that, okay? Nobody mentioned anything about sexuality. Nothing, zero, zilch, nothing. 2 months after the end of radiation, I'm with a partner, and let's have sex. Ouch, pain, penetration. Why is there pain? And I thought, oh, maybe the vagina hasn't healed yet. But it felt like it was a different kind of a pain. Within a few days, I get a text from my sister. And she says, my friend who's a radiation oncologist said that usually radiation oncologists don't talk about this, but tell your sister to use dilators. And I'm like, what are dilators? I have surgery coming up in 10 days. I quickly look on the internet, and I'm like, I'm not going to deal with this right now. I'm going to go through surgery. I'm going to heal from surgery. My brain's a little bit more open. I'll go look, okay? So after surgery, I start doing research, and then someone says, oh, Kineret, you're so positive. I want you to meet another friend who has a stoma. I had a stoma, but then ileostomy. She wants to talk to you because she doesn't want a stoma, because her dad had a stoma. And I said, okay. And I talked to her, and I'm like, by the way, do you have pain with sex? And she says, oh, actually, she had anal cancer 3 years before she was treated with radiation. She said, actually, what happened was the scar tissue grew after radiation, and it closed up the vagina, and I can't have sexual relations with my husband. And it's been 3 years. And I said, wow, did you ever speak with your radiation oncologist? Did you say anything to anyone? No. Too taboo, too uncomfortable, right? Then I met another woman, and I said, do you have pain? She said, yeah. And I said, did anyone tell you about this? No. Okay. When I joined the colorectal Facebook pages, I put a post, and I said, are women having pain with penetration? What's going on? What is this? So it took me a while to figure out, okay, that there's scar tissue in the vagina, right? The rectum sits here, the vagina's right on top, radiation beam comes, it's focused. It's focused on an area, and it gets the vagina, and it creates scar tissue, and the scar tissue has nerves, and the nerves are hypersensitive. So anytime anything goes in there, whether examination or a penis, it's going to hurt. Okay, it's like this. And I'm thinking, what am I supposed to do with that now? 45 years old, what am I supposed to do with this? How am I going to connect? What's going to happen? And then I kept asking, what are women doing with pain? What are women doing with pain? I went to 2 different gynecologists. They said, your pain is because you have a dry vagina because you're in menopause right now. I'm like, it's not the dry vagina. What is it? They didn't know, or they didn't want to tell me. I don't know. But from the women, from like how important it is to be in support groups, because they said it was scar tissue. And they said, please go see a pelvic floor physical therapist, right? And please use dilators, and please have a lot of lubrication on it. And I said, but what are you doing with pain? Okay, I called my radiation oncologist and said, well, I hear for all these women are getting dilators. Can I have dilators? And the office said, no, we only give them to gynecological cancer patients. And I said, what? How can this be such a lack of awareness? And I had to explain. The vagina sits on top of the rectum. You hit it with a beam, it's going to get hurt. So I'd like a dilator.
It's hard too, because, you know, it's a lack of knowledge for some. For others, it's a difference of opinion of when. You know, I've heard you should be doing this during radiation. I've heard you shouldn't be doing this until after radiation. And so there isn't a consensus in this area of discussion. And I think that's really hard. You know, it's also there can be a focus in some doctors on, I need to save your life. That is secondary. And so it's not important to them, but it is important to you as a patient, as a human being, you know. And so again, you know, it's not fair that it's incumbent on the patient to have to bring this up and to ask for the help. And then if you ask for the help, you should at least receive it, not be gaslighted or, you know, just say, well, such is life, you know. And so I think that it's really important to, if you're not finding the right answers from that particular doctor, to not stop there. Yeah. You know, like you said, support groups are a great way to find information. But I think at the same time, it's really important to know where your information is coming from. You know, support groups are great, but not everybody understands that, you know, it's not right to say, well, you have to do X, Y, Z, unless you're a practicing clinician who has seen this person's records, right? You know, yeah. It's fair to say, well, this worked for me, and then it triggers conversations that you can have with your medical team. But I just wanted to point out that it's really important to make sure that you are finding information from not just, you know, Dr. Google, because that can be dangerous in itself.
Yeah, that's true. That's true. And in my case, I needed to find it from other patients, right? And so I did a survey on Facebook, and I asked, you know, how many women were told, you know, about sexual dysfunction after the radiation? And 100 women got back to me, and 25 of them were told everything. They said there was going to be scar tissue and they needed dilators, and good. And 12% were on the Facebook pages, so they brought up the information to their doctors. And 63 women said they weren't told anything. Nothing. And different variations of information. So I want to read to you some of what they said. Tammy from Georgia was told she wouldn't be able to get pregnant after radiation, that she would go into early menopause. She was single for a couple of years. The first time she had sex, there was so much blood that she had to go to the ER. The doctors acted like she had done something to cause it. She didn't know why the bleeding happened and felt embarrassed by what the doctors thought. No one, including her gynecologist, had told her about the scar tissue. He just said she was having a lubrication problem. She didn't know why sex was painful. She had never been told about dilators. That was 5 years ago. Intercourse is still painful. She says it's frustrating that many doctors don't take the time to discuss how the body will be affected by these treatments. Jennifer was giving a printout about the side effects to read at her convenience. She felt she had no choice and was already nervous about what was happening, but just how severe the scar tissue in the vagina and the bowels was not mentioned. She learned about it by reading other women's stories online. She wanted to thank me for bringing this issue to the public eye. Lisa's doctors from Oklahoma did not tell her about vaginal effects. She's livid. If she had known, she would have declined radiation. Chemo was enough to shrink her tumor for surgery. So this goes on and on and on. I have a lot of their stories. Why? Because I wanted to give them a voice. And I wanted people to understand the severity of what it's like when women aren't told, what's going to happen. And what was amazing to me reading all these comments was the difference in information given. So what do I want from this? I want medical transparency at the highest level, at a national level. National. And so every woman that goes to get rectal cancer treatments is being told the same information. Not that one person is not going to know if she can have children afterwards or not, and another one be told all the effects. So I don't know exactly how to do this, but this is like part of it. If you know how to do it, please let me know after.
And colorectal cancer is on the rise amongst the young populations, the early age onset. And it's really critical to be able to talk about these things, because these are not people who are in the later stages of their life where this is for the rest of their lives. These are people that are in the age range of wanting to have families and have long-standing partners, and it's really going to have a huge impact on their lives. So it's important to share this. And so, I know there's a lot of frustration around this, not just from you, but from a lot of other patients, from feeling like, why have I not been told? So with the patient feedback in mind, and keeping standard of care in mind, how would you ask doctors to share this information with you in a way that that they can, because they're fighting the time factor. They have so many patients. I need to come in and give you the information you need, and then I'm out to the next one. How do we slow that down, or how do we insert the conversation as an important piece of the care?
Yeah. For me, standard of care is not just the medical, but we have to see what's going to be the quality of life later. And so that has to be factored into the consultations. Whether it is with, written, a video. I think every radiation oncologist office must have a sexual health nurse or a sex therapist. Someone that really can help the patient. If I were a doctor, and I'm not, I would sit down with a patient and say, listen, I'm going to tell you some things, and some of them are going to feel like they're really harsh. But I want you to just take a breath for a moment. Radiation affects sexuality for women. Why? Because it sits right above the rectum. Mm-hmm. And when we focus the radiation beam, it will create scar tissue, and there will be nerves. And so then penetration, anytime anything moves near the nerves, it'll feel painful, very sensitive. So there are things that we can do to mitigate it. Whether it's anti-pain cream, anti-nerve pain cream, there are things. And we'll have a person assigned to you, walking with you, explaining everything. We have a sexual health nurse, so you can feel comfortable about this treatment plan.
Yeah, and
something like that.
I know that a lot of the major cancer centers now have early age onset programs where the discussion is not just the let me save your life discussions that your oncologist tends to have with you, but the totality, the holistic care, right? So talking about the sexuality, talking about long-term survivorship, and what kind of additional screenings that you might be needing to schedule, that you're at higher risk now for other cancers, dental, all these other things start to be factored into the discussion. So I think that's another important way of bringing those discussions in. Let's pivot for a little bit. We've had the chance to talk about the sexuality. You mentioned a stoma earlier. I'd like to go into kind of other side effects. So with the stoma, for those that don't know, that is a redirection of your colon while you're healing. Sometimes we end up with temporary stomas that can be reversed, others cannot. You know, we in the community sometimes call it a front butt jokingly, because you're pooping into a bag, you know. So, you know, again, these are things that are difficult for people to talk about. A lot of people are afraid of stomas. There are body image issues that can come with it. Dating is really difficult to factor in. When do I tell them that I have cancer? How do I tell this person without scaring them off? You know, what are some of the other things that you've encountered with stoma and body image, especially with dating?
Yeah, I'm pretty straightforward, you know, so I just say things as they are, you know. And when I had my stoma for 8.5 months, it was fine. It took some time to learn, but my quality of life was mostly great with it. An ileostomy is different than a colostomy. Mm-hmm. So when there's spillage and it kind of starts to eat up around the stoma, if there isn't a tight seal. But it, you know, for me, was okay. What about you?
You know, I actually had a very positive experience with my colostomy. I am a permanent colostomate now. You know, it's kind of funny because I actually wished that I had this as an option way back from the beginning. You know, my doctor with my initial surgery with the resection worked for 9 hours to make sure that I didn't have a colostomy or even a temporary ileostomy. And at that time, it was said in a way that was like, oh, we're doing this for you. And I was like, okay, well, I guess that's a bad thing, you know, because I didn't know very much about it. And as the years went on, I had to deal with LARS. And LARS is basically you're tied to the bathroom. Whenever you're going anywhere, the first thing you're looking for is, where's the bathroom? How quickly can I get to it? Do I have a seat where I can make a quick escape if I need to? Carrying emergency supplies, having extra changes of clothes in the car just in case, having my husband and my daughter kind of like scope out the aisle. Is it clear for me to run down because I just had an accident? You know, all these different things that you're dealing with. And when I got my colostomy, all of that went away. I got back hours and hours of every single day that I wasn't sitting on the toilet, you know? And so for me, it's been a very positive thing. It hasn't slowed me down. And in fact, quite the opposite. I can go swimming. I can, like, first question, everybody's like, well, can I get in a jacuzzi? Can I swim? Like, can I shower without this thing type? You know, so all these things are, yes, you can. And it's actually allowed me to do so much more than when I did not have it. So for me, a lot of my advocacy and my sharing with, especially one-on-one with new patients that are looking at this is, you know, it's a temporary inconvenience for some, where it's temporary. Yes, you have to deal with the bag changes, you have to deal with the skin issues. But in the long run, for me, as a permanent solution, it was fantastic. It has been fantastic. And I share that with people, and it's surprising, you know. And what I've found is when people hear things shared in that frame, it's not so scary. It's kind of like, oh, well, I can do that. Oh, that doesn't sound horrible. Like you know. And so I think that how information is presented to us is very important as well.
Totally. I think we're getting close to kind of time over there.
We are.
Yeah, thank you. The book has a lot of things in it. A lot of things. What to do with the mental, emotional, what to do with the spiritual. But this is the time we had for today.
So thank you
so
much.
Thank you so much. I don't know about you guys, but I had a few verklempt moments there listening to you talk. We're going to take questions now. If anyone has questions in this room, yes, please.
Thank you so much for talking. Can you guys speak to what it was like navigating the pandemic as cancer survivors?
That was not easy. For me, I immediately instituted hospital rules at home. Nobody came into my house. We sprayed down the bottom of our shoes before we walked in, or you took off your shoes. Hand washing as soon as you came in. If you brought anything in, it immediately got wiped down. Not knowing what was out there and being immunocompromised was something that we definitely had to be cautious of. And as the world opened up, it didn't necessarily mean the same to us as quickly.
Yeah, for me, 2020 was about 2 years after I finished chemo. It was okay. It was just, I think, a little bit annoying with the challenges of appointments and doing all the tests and waiting and, but can I do this? But it went okay for me.
I think the harder parts is the delay of treatments, things that were optional, were not really optional for us. And those that needed the emotional support didn't have somebody to sit through chemo with them if they needed it because it was not allowed. So those things were really difficult.
Other questions? Oh, Nancy, yeah, go ahead, sorry.
For a lot of patients, they don't have that comfort zone. And a lot of times they'll do something that they think their family wants them to do. How does one, as a caregiver, support or open that conversation to allow that patient to be true to what they really want? Any recommendations?
Yeah, I think what you said is perfect. I would say it in exactly the same way. I care about you and I see this and I just want to check in with you. Is this what you want to do? Is this really up to you? Because only you know what's right for you. And it's so much easier to go with your path.
So I have a question. For sexual dysfunction, how effective has the dilators and like you said, nerve cream? I don't know if there's anything else, or is there anything else that can be used for
Sure. Do you want to take that?
I had pelvic floor therapy has been a real big factor for me. Just getting that consultation early on to figure out what can we do, because it's kind of a use it or lose it situation. If you don't get these issues worked on upfront, then it becomes harder later on. So I think that it's important to try to get those consultations ahead of time. But the dilator work is something that definitely is helpful, but you have to have that patience to go slow and devoting the time to it, because it does take a lot of time. And then, yeah, I would say that the nerve creams are helpful because they will help to not be so sensitive to the pain.
Yeah.
Who prescribes that? Did you guys get that from the pelvic floor therapist or your gynecologist?
For me, the dilators came through my pelvic floor therapist, and then any creams or prescription things came through the gynecologist. And it's important to find a gynecologist who has experience in oncology as well, because they have seen and helped others with similar situations. I always recommend to go through hospital referrals, because your oncologists here are typically going to refer you to other doctors that already have that experience. There are a couple. They're not on site here, but yes.
And just to be clear, the pelvic floor therapist is a physical therapist. This is physical therapy.
That's correct.
Yeah, so who specializes in pelvic floor therapy.
That is
correct. Okay.
And they are amazing here. Our pelvic floor physical therapists here are incredible.
Mm-hmm. Yes?
I think you have a point in your treatment where you felt uncomfortable with your provider, oncologist, whoever, and felt you had to make a change.
Yeah, for me, many times actually. Yeah, because I did the alternative method, I'm going to say oncologists I could feel the judgments coming at me. It in some cases, it was very uncomfortable. And yeah, I did make changes when I realized the doctors work for me and I can hire and kind of fire. Yeah.
Yes. And I was lucky. My oncologists have been amazing, but I always keep in mind second opinions are very, very important.
Anybody else?
For the national perspective, you said you tried, making sexual dysfunction more aware. Did you try the NCCN, the National Self-Advocacy Cancer Network? Have you been reaching out to them?
No, not yet.
They're
Thank
great.
you.
And CCS is great too.
Anyone else? So thank you so much, speakers.
Oh,
Oh.
out there.
Phuong is going to be staying here. If anyone wants to approach, you can talk to Phuong here while Kineret is outside signing. Okay, thank you. I know.